And Vermont is still the most vaccinated state in the nation, but the spread of the Delta variant in some parts of the country had state officials answering questions on whether Vermonters should be worried. Local 22's Devin Bates joins us live in the newsroom with more from the briefing. Devin?
Yeah, Lauren, the Delta variant now accounts for half of recent COVID cases across the U.S., but officials say Vermont's 82.4% vaccination rate has stopped the variant from taking hold here. Governor Phil Scott was asked Tuesday if he thinks there's anything from Vermont's playbook that could help other states that haven't had as much success in getting people vaccinated.
We do offer advice, but I'm not sure that everything we do here in Vermont would necessarily work in another state. You got to meet them where they are, and you have to gain their faith and trust, and you have to tell it to them straight, and hopefully they'll follow through.
Governor Scott said Vermonters' trust in the vaccine and the state's refusal to make it a point of political tension is something that's missing elsewhere in the country. He added that's not necessarily the fault of other governors.
It started, I think, with the previous administration, whether it was anti-masking, whether it was just that this COVID was going to be over in a matter of a couple of months. I mean, it just started then and went downhill from there.
In some states, the Delta variant is causing more than 80% of new COVID-19 infections, and this comes amid concerns the big three vaccines have varying degrees of effectiveness against it. State Health Commissioner Dr. Mark Levine took to the podium Tuesday to reassure those closely following the results of new studies.
All the vaccines we're using in the United States are highly effective. That includes J&J. And since we have such high vaccination rates in Vermont, our level of protection is even higher.
Still, some are already asking about booster shots for the Johnson & Johnson vaccine, despite Dr. Anthony Fauci saying there just isn't enough data to recommend that yet.
There's no data currently on how the Johnson & Johnson vaccine specifically would work with the other vaccines. We will eagerly await this data, monitor the CDC's recommendations, and share any new guidance as soon as it is available.
And Lauren, the state is not letting up on vaccine clinics, and they don't plan to for a while. There's a bunch planned this weekend as well, including Saturday at Waterbury's Not Quite Independence Day Parade and at Roosevelt Park in Burlington. For more info, visit the Vermont Department of Health website. Live in the newsroom, Devin Bates, Local 22 News.